Hello everyone, my name is Zahar Cornelius Patrick, and today I will tell you a little bit about Kawasaki disease. Kawasaki disease is also known as mucocutaneous lymph node syndrome because it affects the lymph nodes, skin, and mucous membranes inside the mouth, nose, and throat. It is ultimately an inflammatory disease because the blood vessels throughout the body become inflamed. There are three clinical phases of the disease: the acute febrile phase, the subacute phase, and the convalescent stage. As it pertains to gender, Kawasaki disease affects boys more than girls. The ratio is 1.5 to 1. In regard to ethnicity, it affects people of Asian ethnicity, more specifically Japanese and Korean children. People of Afro-Caribbean ethnicity are affected commonly as well. There are many vasculitises, which are conditions that cause inflamed blood vessels, but Kawasaki disease is the most commonly diagnosed vasculitis. The highest incidence of Kawasaki disease occurs in Japan, with the most recent study placing the attack rate at 218.6 per 100,000 children under 5 years of age. That is 1 in 450 children. 80% of patients are identified as younger than 5 years of age, and there are about 2,000 to 4,000 cases in the U.S. each year. Most cases are during winter and early spring. As previously mentioned, the first stage of the disease is the acute febrile phase, lasting 1 to 2 weeks. There's a fever that is often higher than 102.2 degrees and lasts more than 3 days. Symptoms include extremely red eyes, a rash on the main part of the body and in the genital area, red, dry, cracked lips, and an extremely red, swollen tongue known as the strawberry tongue, swollen red skin on the palms of the hands and the soles of the feet, swollen lymph nodes in the neck and perhaps elsewhere, and extreme irritability. In the subacute phase, there is peeling of the skin on the hands and feet in large sheets. Accompanied by the peeling is joint pain, diarrhea, vomiting, and abdominal pain. In the convalescent stage, which begins when all clinical signs of illness have disappeared, signs and symptoms slowly go away unless further complications develop. This chart shows the clinical manifestations of the disease. To the left, you have the symptoms. It is sectioned off by stage of the disease so that you can see which symptom happens in which stage. At the bottom of the chart, you can see the amount of weeks that each symptom occurs. The true cause of Kawasaki disease is unknown, but scientists don't believe the disease is contagious from person to person. Theories link the disease to bacteria, viruses, or other environmental factors, but it is also speculated to be an autoimmune mechanism. Certain genes may also increase a child's susceptibility to Kawasaki disease. Kawasaki disease is a leading cause of acquired heart disease in children. Heart complications are the most important aspect of Kawasaki disease, and they include vasculitis. Then there's inflammation of the heart muscle, which is known as myocarditis. Issues can also arrive with the valves of the heart. Inflammation of the coronary arteries can lead to weakening and bulging of the artery wall, which is known as an aneurysm. In a very small percentage of children who develop coronary artery problems, Kawasaki disease is fatal, even with treatment. This image shows a picture of a coronary artery aneurysm. Kawasaki disease can only be diagnosed clinically. No specific laboratory tests exist for the condition. It is difficult to establish the diagnosis, especially early in the course of the illness. Many other serious illnesses can cause similar symptoms and must be considered in the differential diagnosis, such as the conditions listed here. Many children, especially infants, eventually diagnosed with Kawasaki disease do not exhibit all of the shown criteria. In fact, many experts are now recommending treatment for Kawasaki disease even if only 3 days of fever have passed and at least 3 diagnostic criteria are present. In addition, the diagnosis can be made purely by the detection of coronary artery aneurysms in the proper clinical settings. The crash and burn method, as displayed in the picture, is a simple mnemonic used to diagnose. Treatment must start immediately in order to reduce the risk of further cardiovascular complications. Standard treatment includes infusion of an immune protein known as gamma-globulin through an IV, which can lower the risk of coronary artery problems. High doses of aspirin may also help treat inflammation and pain. Corticosteroids have also been used, especially when other treatments fail or symptoms recur but are not recommended because of their association with increased risk of coronary aneurysm. With proper treatment, the prognosis is good. Data is limited, but death occurs in approximately 1% of affected children. 20 to 25% of untreated patients develop cardiac problems. Aneurysms develop in less than 5 to 10% of patients treated with IV gamma-globulin before the 10th day of illness. Recurrence is unusual. The recurrence rate in Japan is 3% and approximately 1% in North America. Most relapses occur within 2 years from the initial episode. That sums up the unfortunate condition of Kawasaki disease. Thank you all for watching.